Hi, welcome to this session of Quicksin, in which whether you are new to Quicksin or whether you are just seeking a refresher, we intend to go through how it can be incorporated into your PSP consultation and covering of a number of items as we go. And it is to help you gain an understanding of the purpose of Quicksin and when we use it. Learn how to use it, which is nice and simple, and get a good understanding of just where it fits into our PSP consultation and actually all our interactions with patients. So, let's start off at the beginning. Quicksin is a diagnostic tool. It tests the ability to hear speech in noise. More accurately, it tests the effect that noise has on our ability to hear speech. It quickly and easily measures that ability, which is not something that you can get just simply from a pure tone audiogram. It's designed to use with all patients, new and old, as part of their routine audiometric testing. And it has become an integral part of our own PSP consultation. Often asked, why should I use it? Well, there are lots of advantages to Quicksin. Firstly, it's very quick, it's very easy, and it's easy to score. And in fact, the system does that for you. The results can be used to make specific treatment recommendations. In fact, it will impact on some of your prescriptions depending on the outcome of Quicksin. It's very helpful in setting expectations at an early stage for your client. An additional benefit is that patients actually get a better indication of how they hear in the real world. To access Quicksin, you go through the normal screens that you would see on your audiometer, going through into audiometry, and then once you reach this screen, rather than pressing the audiometry at the left hand side of the four boxes, you will actually go into Quicksin, which will present you with this particular screen. The starting point is to make sure that both ears are selected. You then select the correct ear tone, and then you select standard. One important note is that it defaults to 70 dB, whereas the preferred setting will always be 15 dB above the pure tone audiometry average, which is located on the left hand side of the audiogram. It is important that this is set at a level so that the first sentence, if not heard in its entirety, is heard clearly by the patient. You will then give them advice that you will play a young lady saying some words, and you will ask them to repeat back what they have heard. The noise itself will go up in the background, but they are not to worry about that. To start the process, you select the list that you want, and you go to the play button, click the play button, and then it starts it off. The support will come and sit next to you, and they can see you scoring the correct words as they appear, and they will then know what the patient should be hearing and saying. It will score itself, and it will then, once you run through the whole 6 sentences, which you do by clicking the right hand arrows, it will systematically go through them and give you a description and a total at the end of the process. Just a little reminder of the couple of the important facts, which are or it defaults to 70 dB, but the preference is you start 15 dB above the average pure tone audiometric score, which can be found on the left hand side. I hope that has been helpful in terms of the preparation for the test. In terms of interpreting and explaining the results, we do have a classification for you, which you can see on the screen, although when dealing with patients there are much easier ways than using this. And then in terms of where it fits into the PSP, it comes in stage 4 after you've done an unaided word test. You then proceed on to Quicksin. I trust that has been helpful for you, and good luck.